a webinar series. As a brief introduction to the series, I would like to share that EGROW Foundation, which started in 2018, is a research-based policy think tank, and we believe in providing policy advice based on solid research. Since COVID, we have been working on these contemporary issues, and to address the COVID issues, we thought we'll start a webinar series. We wanted to bring a blend of foreign and Indian scholars and the best minds from across the world. We have been greatly successful in doing that. We have handled various contemporary issues, got the best minds, thought about those issues, and made recommendations. We have been very fortunate to have had two Nobel laureates also come and speak to us, as well as many celebrated economists who have come and spoken at our forum. We have also been discussing issues on geopolitics, and we have had series of discussions as an illustration on Russia-Ukraine war. Actually, one of the discussions we had 2 weeks back was two ambassadors and army general, and yesterday we had an army general in the chair and two professors from Berkeley speaking to us about the war. Very successful in that sense. We have also conducted a few webinars for G20 under Task Force 5, and not officially, but now again under G20 Empowering Women, we are having 10 webinar series, 3 of which are completed already. It is in this very context that we bring out the burning contemporary issues and try to discuss and understand what is happening in the country or across the world. One issue which came to my knowledge very recently, and we had been discussing in our country already, was the residential segregation and unequal access to local public services in India. And this was a very large sample, evidence from 1.5 million neighborhoods. The study uses the data from 2011 to 2013. And we thought, for many years, we in India used to think that our policies are designed in such a way that they address the marginalized segments of the society. We have been hearing various things that public policies, public facilities are designed to meet the requirements of marginalized segments of the society. So when we saw this paper, which has 5 authors and Professor Sam Asher from Imperial College London leading the lead author, we wanted to discuss this paper and understand what goes behind it. In the meantime, our advisor, Dr. Bhalla, had already been thinking on some of these issues. So we thought it would be a good idea to get the speaker, the author, to speak to us, and then Dr. Bhalla to discuss this paper. So let me introduce one of the authors, Kritarth Jha, who is a young scholar who has completed his MPhil from University of Cambridge in 2018. And before that, he had done an advanced diploma in economics in 2017. And before that, he had done his studies at the IIT Kharagpur and completed his BTech in biotechnology and biochemical engineering in 2016. He has worked at the Development Data Lab since 2020. And before that, he was with the JPAL South Asia, Patna, where he worked, I think, from 2019 to January 2019 to August 2020. He's also had some internship experiences, and this was with the Deutsche Bank in Mumbai. With this, I would of course invite Kritarth Jha to present his paper, and then after he has presented his paper, we will request Dr. Bhalla, and Dr. Bhalla is very well known. no point introducing him.
Hello.
Briefly, he's been the executive director at the IMF
Hello.
recently. He was also a member of the Prime Minister's Economic Advisory Council before that. So we will invite him to present and share his thoughts after this paper, which Kritarth Jha is presenting to us. I must mention that the study by Kritarth Jha and Sam Asher is very, very exhaustive, referred to many papers which we in India thought are very good and priceless. And there's a study by Raj Shetty, excellent study. There was another study by Deepak Malgan and with his co-authors Dameen Bhati from Harvard. So this study by Sam Asher and his team, I thought is an exhaustive study. So I look forward to the presentation from Kritarth Jha. Just a second, Kritarth. Professor Kundu, you have something? Can you hear us, Professor Kundu? Professor Kundu, we can't hear you.
Yes. Can you hear me now?
Yeah, we can hear you now.
Also, it took time for me to hear you. It took me to adjust something. Thank you. I'm now on.
You're on, yes. So we are having Kritarth to present his paper. We are going to follow it up with Dr. Bhalla. And then after Dr. Bhalla, if you have some thoughts, I would like to invite you to share your thoughts. I hope that's okay. Yeah.
Thank you. That will be my privilege. Thanks.
Thank you. So Kritarth, all over to you.
Okay, thank you, Dr. Charan. Let me quickly share my presentation with everyone. There we go. Just confirming that you can now see my screen.
Yes.
Yes.
Thank you. Thank you for that lovely introduction, Dr. Charan. This is today's presentation is going to be on residential segregation in India. This is joint work with Sam Asher at Imperial College, myself, Paul at Dartmouth, Anjali Adukia at Chicago, and Brandon Tan at the IMF. Broadly, before we move into the paper, like our broad research agenda at DDL has been, using high resolution data to see what factors shape economic opportunity. And earlier, a lot of these questions have been, people have tried to answer these questions using data that's less granular, but now we have very high-res data, from government sources, from large-scale government surveys, satellite data, etc. And this really lets us ask some of these questions in a way that we couldn't earlier. And as a byproduct of that, at DDL, we create a lot of open data that other researchers, policymakers, civil society, and of course the private sector can also use. So that's what we've been doing at DDL. And coming to this paper, we try to ask how residential segregation can constrain access to opportunity, right? And for this, we create a new data set, which has about 1.5 million neighborhoods across rural and urban India. And the first thing we do is we characterize what segregation looks like for these neighborhoods across India. The next thing we do is we show how public service provision differs across these neighborhoods and how economic outcomes also vary in these neighborhoods. Now, a general question that you might have in mind is what's the additional advantage of you get while looking at data at a very high resolution at the neighborhood or even more granular level than you would say if you looked at this data at the country level or even say more granular at say the district level, right? And for that, let's have a quick preview of results. So what I'm going to show you are different coefficients from a regression of public service provision on marginalized community share of a neighborhood. And what you see if you ran a neighborhood level regression with at the state level, you'd come to the conclusion that in neighborhoods with 10% more SCs, there are 0.03 more secondary schools per lakh people. Similarly, if you looked at it at the district or at the across district or across the town level, you'd see that as the number of SEs increase, they get more secondary schools. However, if you actually had data at the neighborhood level and you're looking only across neighborhoods within towns, right, you'd see that there are actually one fewer school per lakh people. So you end up with this aggregate number that kind of gets hidden unless you see what the mechanics are at the neighborhood level. Similarly, for Muslim neighborhoods, if you see the disparities, and I'm just going to quickly go through this, you see that if you see how many fewer schools per lakh people there are in Muslim neighborhoods, you see that the bulk of the reduction in the disparities in secondary school provision is actually happening across neighborhoods within towns. And if you didn't have neighborhood level information, this information would not reveal itself to you, right? So that's a kind of a spiel to say that high resolution data is critical to answer interesting economic questions at a granular level. So let me give you, now that I've tried to convince you that high resolution data is important, let me tell you what we're going to find at the end of this paper, right? We're going to find that Muslims and SCs in India, in urban India as well as rural India, are very highly segregated, and that minority share of a neighborhood predicts access to public services. And a lot of this disadvantage is primarily coming across neighborhoods within towns and villages, right? So it's not something that's happening at the district level or the sub-district level. It's across neighborhoods within towns and villages. The third thing we're going to find is that young individuals in these neighborhoods have worse educational outcomes. And one finding across all of these analyses is that Muslim neighborhoods are significantly worse in outcomes than SC neighborhoods. Context, I guess everyone kind of knows what context is in an Indian sense, but I would like to point out some recent studies, surveys by Pew, which could kind of hint at the reasons why there is high residential segregation. And in this Pew survey, we find that across religions, very few people are willing to have neighbors of another religion. And if you look at intermarriage rates, opposition to religious intermarriage is high across religions as well. And while we show this because we don't really, we mostly have descriptive results in this paper. So causal estimates are probably for another paper to find, but from these surveys and these descriptive studies, we can probably get a hint of what's happening behind this. Right? From our earlier work by Asher Novosad and Rafkin in 2021, we've shown that in terms of economic mobility, there is significant disparity in how much economic mobility there are by different caste groups. And we find that Muslims have been faring poorest across all different groups over time, and more recently, where scheduled castes have been doing well these past few decades. So it is with this context in mind that we then come to segregation. And before we look at segregation in India, it's kind of good to think about what we'd expect ex ante the effects of segregation to be, right? And the evidence is mixed, and even theoretically, it's not clear whether segregation in and of itself is good or bad, right? There are potential harms of living in segregated neighborhoods, which is that people often depend on networks for jobs and education, and if you're in segregated neighborhoods, you might be losing out on these opportunities. It might be easier for the state to discriminate against you. At the same time, there are potential benefits, right? The major one being that if you're in your own neighborhood of people, you're much safer there. Some people prefer to live with their own social groups, such as immigrant enclaves in many nations. So it's not clear what effect segregation would have going into this, right? Now, in the US, this question is studied very extensively, right? And in the US, the study of segregation has moved on from establishing that segregation exists to establishing the causes of segregation, such as white flight, such as the Great Migration from Black migrants from the South. There is research into the legal backings of segregation, where laws such as redlining and racial covenants, have led to segregation. So in the US, the frontier is significantly ahead in the sense that they're figuring out what the causes of segregation are there and what the effects of segregation are, where they found worse outcomes for marginalized groups in the US in terms of mobility, health, and education and labor market outcomes, right? In lower income countries, there's been lesser research in terms of segregation. And part of this has to do with data access. Anytime you talk about segregation at a town or even a village level, you often need data at one level below that. So you need data at the neighborhood level. And for many nations, this data hasn't been available. So in the absence of this data, there's a large literature on ethnic fractionalization, which doesn't need data at a finer resolution. And there's been some research. There's been quite a bit of research on ethnic fractionalization, but very little on segregation. And of course, there are a couple of examples here and there, but nothing very systematic that's been done outside of the US. In India, we've had a large body of qualitative literature on this from the political sciences as well as in economics. There's obviously the Sarcher Committee report from 2006 on poor access to public services for Muslims. And more recently, there's been great quantitative work on segregation coming out from Bangalore with Bharti et al., as Dr. Charan also mentioned. However, in all these analyses, there's no link between segregation or neighborhood composition and what effects it has on public service provision. And as I'll say in a few slides, by linking different sources of data, this is what we're able to provide in this paper. Now, the data that we use for this paper primarily comes from two sources, even though this is a presentation being given in 2023, this data is almost a decade old. It uses the socioeconomic class census done in 2012 to get demographic information, and the economic census from 2013 to get information on public services. And what the feature that lets us do this is that the same unit of neighborhood, the enumeration block, was used for all three, the population census as well in 2011, and all three censuses that were done at the time. So at the enumeration block level, we're able to link the SECC as well as the economic census, and that really lets us correlate demographics from the SECC with public services and public provision in the economic census. And of course, as we move on, this is a plug for our open data platform, the Shrug, which is what forms the backbone of this analysis, and that really lets us join different data sets. In this paper, we just use the SECC and the economic census, but if you go on our website, we have this for all sorts of GIS features, satellite data. There's a lot of information on political outcomes as well as other variables from the censuses there. We've got a new version of the Shrug out, and once this paper is complete and published, we will be putting out all our data as well at the neighborhood level on the Shrug. So if you are also a researcher, this might be of interest to you. All open source, free to download on our website. And this is what basically allows us to do the analysis in this paper as well. So in terms of outcomes that we look at, we're going to be looking at outcomes for public services. And now, admittedly, there are a limited number of public services that we can look at, right? So since all of this data comes from the Economic Census 2013, the main things that we're going to be able to look at is education and health. And particularly primary schools, secondary schools, and a wide definition of health facilities as defined in the economic census. And for all these variables, we're going to use both an indicator for whether a public service exists in the neighborhood, as well as the log of the employment of these at these facilities within the neighborhood. You'll find that irrespective of what outcome variable we use, the results don't change much, and they're pretty robust to changes in the y variable. Now, when we talk about measuring segregation, often the index that we're talking about is dissimilarity, right? And the formula is on the screen, but the intuitive definition of this is that suppose you had a town with a certain percentage of minority population, and it was composed of neighborhoods with different populations. Dissimilarity measures how many people would have to move across neighborhoods so that the same percentage of minority populations are present in every neighborhood as of the higher town. So even though it's kind of when we say evenly distributed, it means evenly distributed for what percentage of minorities are in that city, and not like a perfectly 50-50 even distribution, right? And while, of course, this comes from the context of segregation in the US, where there are primarily two groups to study, other measures of segregation as well are highly correlated with this. And so if you use the Gini entropy isolation, all of it is very highly correlated, and it will look similar to the dissimilarity index. But in addition to looking at segregation through dissimilarity, we also have a non-parametric distribution of where people live in neighborhoods. All right, so now we're going to look at the first set of results on segregation in India, right? And the summary statistics, there's a lot in here, but essentially if you look at the first column, this kind of tells you that when I talk about neighborhoods for urban areas and rural areas, these are roughly neighborhoods with 500 people each. And there are a bunch of other summary stats across variables. But coming to neighborhoods, this is, again, a distribution of what it looks like. In the census, an enumeration block is supposed to have about 100 to 125 households, or 600 to 700 people. In the data, it's closer to 500, but we're almost there. And then, of course, there is a distribution around it. This is just to say that in any of our results, these neighborhoods are kind of capped, between 500 to 1,000 people, and it's not that one particularly large neighborhoods from anywhere are going to shift our results, even though we do control for neighborhood population in our regressions. Now, if you kind of wanted to see the distribution of how many towns are how segregated, we have a density function which kind of shows you, if it helps, it's kind of like a probability density, except that you use k-density functions over here. But a more intuitive understanding of how dissimilarity looks across towns and urban areas and subdistricts in rural areas is to look in how minority groups are distributed across these neighborhoods. So across both rural and urban neighborhoods, you'll find that the Muslim population has a bimodal distribution, which means that there are a lot of Muslims who live in neighborhoods which have a lower Muslim share than the national average, as well as another peak over here of Muslims where there are a particularly high share of Muslims in that neighborhood, right? So even though there are very few neighborhoods where there are a high concentration of Muslims, about 20% of Muslims in urban India live in neighborhoods that are 80% Muslim or higher. And this number is lower for SCs, it's about 16%. So that's a good idea to get a sense of how Muslims live across neighborhoods with different shares of minorities in them. An interesting visualization is to see how segregation looks across the country. And what you'll find is that unlike some other socioeconomic variables which have a clear north-south divide, there are pockets of high segregation all across India. There's no very clear pattern that emerges out of this. Also, a side note, the white spaces are actually not indicative of zero segregation. These are just districts for which we had no information. So should have probably used a better color there. One question, that often crops up is in these cities that we have, are they reproducing results from rural areas? And it is indeed the case that we do find that urban segregation for both SCs and Muslims is highly correlated with rural segregation. And now that we've kind of characterized what segregation looks like across India, we will now look at how these different neighborhoods segregation affects disparities in public service provision. Now, for this analysis, this is essentially the preview I'd shown to you at the beginning, where we'll find that there is a lot of disparity at the neighborhood level. So essentially what we do is we run a set of neighborhood level regressions, where on the left-hand side, we have a dummy or the log employment of a public service provided at the neighborhood level. And on the right-hand side, you have the marginalized group share of the neighborhood, and you with controls for the population as well as fixed effects for the city, district, state, etc. Now, what this lets us do is by varying the fixed effects, we can find the across neighborhood, across town, across district, and across state coefficients of distribution of services. Right. So one limitation of what we do here is that we run a very descriptive regression, right? So it's not causal by any means. And in that sense, it is then difficult to distinguish whether the disparities in public good provision is discrimination or whether it's residential selection and self-segregation into these neighborhoods. And then as I said, the public facilities that we talk about are really just education and health, and not a broader set of public facilities. The other thing is that we kind of limit our definition of access to these services by facilities within their own neighborhoods. But of course, people can and do walk to other neighborhoods and other areas at some time and economic cost. So those are the limitations when we run this regression. However, when you do run this regression, you will find, this is a non-parametric bin scatter. And what you'll find is that, if you look at the image on the left, as you go from a neighborhood that's about 0% Muslim to one on the right, which is about 100% Muslim, you see this clear decline in the provision of secondary schools, right? For SCs, the story is a little more complicated. There's a non-parametric relationship here, so it's not very clear. But even in this case, you see that as you go to like a higher share of SCs in a neighborhood, you see there is a decline in the provision of secondary schools. The same results, we have a linear approximation to these, results. And what we find is that if you looked at the Muslim share coefficient across all our public facilities for primary and secondary schools and health facilities, you'll see there's a negative coefficient everywhere. And if you kind of focus on column 3 for Muslim share, what you'll find is that these are actually really high. In fact, going from a Muslim share of 0 to 1 in a neighborhood will almost halve your probability of having a secondary school in that neighborhood. And again, this is the image from the preview for Muslims and SCs, which basically says that this is a slightly different way of visualizing the same regression, and it basically shows that these disparities are kind of arising at the neighborhood level across blocks or across neighborhoods, within towns, and within villages. So this is a story that's happening at the most local levels of geography. And just to summarize, like we said, you know, uh, uh, for Muslim neighborhoods, it's very clear that most of these facilities are allocated away from these neighborhoods. For SC neighborhoods, there are weaker effects, but it's still substantial, and it's the neighborhood level where all of this variation is happening. And again, if you didn't have these neighborhood level regressions, the result would be very different from what we have in this case. And that about concludes the provision of public facilities in different neighborhoods. Now we're going to look at outcomes in said neighborhoods. And of course, while none of these are causal, these are, one step in the direction to kind of determine, to kind of describe what's happening in these neighborhoods. The regression that we'll use for this is pretty simple. We look at young individuals in a neighborhood, 17 to 18-year-olds, and we look at their years of education on the left-hand side, and we regress this on the neighborhood share of the minority group in the neighborhood, and we have then we add controls for family characteristics like education and consumption, and we also control for some neighborhood characteristics like population as well. Now, of course, there are limitations to this analysis as well. While we can have controls on parent income and education, but they are bad controls, and we can't rule out whether people are moving in and out of these neighborhoods. So we do have that limitation. At best, this is descriptive of what's happening to education of these young individuals in these neighborhoods. So what we can see is, if you look at column 1, where we only regress education on indicators of whether an individual is SC or Muslim, we see that there's a significant penalty in terms of education. So SC or Muslim individuals get about a year lesser of education, right? This is in urban towns, urban neighborhoods. But then, as you come to column 2, when you add in the the shares of minority groups into this regression equation, what you'll see is that it's actually these neighborhoods and the SC and the minority shares in these neighborhoods that's driving a lot of these results, and not necessarily individual characteristics, right? So you'll see that in a fully SC neighborhood, a 17 to 18-year-old male would have about 1.5 years fewer of education. Similarly, in Muslim neighborhoods, that's about 2 years fewer years of education than those in like completely non-Muslim neighborhoods. Now, as you come to column 3, as you add in education and consumption controls, those coefficients on both SC share and Muslim share reduce substantially, but they don't really go away. So yes, there is some amount of selection that might be happening, but it's also, there is these disparities that selection might not be able to fully explain away. So that being said, this is all descriptive, and there'll be more work to be done till there are causal effects on this. Okay, so that kind of brings us well in time for of the presentation to the conclusion, where urban India is replicating the high segregation patterns of rural India, and these disparities are occurring at a very local neighborhood level, and these settlement patterns are highly persistent, and it's going to be a long time till these are corrected. And that's the end of this paper. And as soon as we have this paper out, we will be also posting open neighborhood data as well on the Shrug website. Thank you. That's about it on this paper. And I'll open the floor to questions. Let me stop sharing.
Thank you very much, Kritarth. That was amazing research, and the volume of data that you have handled and the open access that you're providing to your data set, that's amazing, and thanks for it. With this, let me now invite, I think it's a very comprehensive paper and almost in the direction which some other papers, of course, the detailed analysis, the disaggregated analysis that you have done is, I think, for the first time, because the study which was done by Naveen Bhati again, Harvard, was 5 cities. That is where it had focused on. But you have done the complete neighborhood across the country. With this, let me invite Dr. Bhalla now to share some of his thoughts. Dr. Bhalla, please.
Yeah. Thank you, Charan. And thank you, Mr. Jha. I mean, I want to join others in congratulating you in assembling an amazing data set and look forward to analyzing it after your paper is published. As you know, there's been a lot of talk about data quality in India. And I was looking for some references to data quality of the two different data sets that you're using, namely the socioeconomic census as well as the economic census. Now, I don't have it. I think you've done a very good job of identifying Muslims, so that's not and the SC, ST, OBC is all identified. So therefore, there is no identification problem there. And I think you've effectively solved the identification problem of Muslims. The question I have several questions about this, but you're basically on outcomes. So geographical segregation, let's address that first. And as you note that, I mean, the maps are nice and so on and so forth, but what's the value added of the result that there is segregation? And it's not that you don't address that, I will come to that, but by itself, I don't know of a single country in the world where individuals or houses are not segregated according to mostly income. If you recall, Tibu had the expression for those youngsters in the audience, the expression voting with your feet came out from Mr. Tibu's analysis, I think back in the 50s, where he noticed or analyzed and published that, the people where there were better school facilities, people moved there, richer people moved there. So in other words, the voting with your feet comes out that income really and housing prices really drive segregation in the US. This is a classic study. So one question I have is, what are the effects, or do you have data to control for the fact that a lot of this segregation that you're measuring is, so what would be very useful is how is it different than, let us take the US. The segregation indices, for the US you can control for income, you can control for virtually anything. I don't know whether you can control for income in this data set. So that's my first set of questions. Second, in your tables, the education outcomes, where you have Muslim and SC and the results, therefore, they're all relative to non-Muslim, non-scheduled caste. Is that correct? Yeah. So what would be, that's what I get. So what would be very, very useful? We all know, okay, if you did, relative to the richest person, that you will have a decline and it lower, and you'll find significantly. If you do it with Brahmins, maybe you should do that with the caste relative to Brahmins, you'll get that. So in this, what would be interesting approach is to look at how are Muslims faring differently than other communities that are facing discrimination, like scheduled castes. So I think I want to look at the T statistic. I was trying to calculate, but I didn't. The difference in the coefficients for Muslims versus SCs. So that's number with whatever the, so the first set of questions has to do with how good is the SECC data on education, and that's, I guess, that's a major variable. And the second is whether, how do the coefficients differ for Muslims versus SCs. Third is, you know, does it all matter? And you do, your paper and you and your authors do make a valiant attempt to look at how it matters. Now, and you know, by looking at education outcomes being different. So let's say that they are very substantially different. They are lowest for the Muslims and they are second lowest for SCs. So, you know, the PLFS data, NSS data for employment and unemployment, which is now called the PLFS, there's a consistent data series from 1983 onwards, all India. Okay, so let's look at how does that show. So I've done some numbers, and I've written about the Muslims versus non-Muslims on wages, but let's look at a very important outcome, which really, you know, for 99% of the people, is your wage income. And I'm looking at wage income across the country, and you can control for women and whatever it is, but this is controlling for Muslims and SCs and other. So the highest wage is obviously, and I've done it across time from 1983 to 2021, the highest wage is obviously that of the other. And it's about 40, was about 40% higher, and this all in real terms, was about 40% higher in 1983, and is now about 20% higher. I'm not even controlling for education, etc. That's separate. Now, amongst Muslims, there are three sets of data that you have on wages. One is for casual workers, one is for salary workers, and since 2017 for the self-employed. And that accounts for the entire labor force in India. And the broad parameters are that self-employed is about 50%. All your Swiggies and all your everybody else is self-employed, obviously agricultural workers, and so not agricultural workers, but agricultural employers, farms. And 25% is the casual workers, which are paid on a daily basis or hourly basis. And then there are salaried workers who are the most educated, who are paid on a monthly basis. And you can control for education, etc., but I'm not doing that. I'm just want to look at outcomes. Does it matter? How much lower wage are you getting if you are Muslim or if you are a SC? In 2021, you have, or let's take 2011, which is what your data broadly corresponds to, that the Muslims have about a 3% higher wage than the SCs, and the non-Muslims, non-SCs have a lower wage than the Muslims. So the Muslims have the highest wage for casual workers. Now, casual workers have lower wages. Okay, so, and I have also got, let us take now the total wage, whether you're a casual worker or salaried worker per day. And for 2021, the salaried worker has 250 for an SC, 260 for Muslim, and 335 for non-Muslim, non-SC. So, and there are a host of other things, you can look at it. I don't want to take too much time, but broadly, the result is that the segregation, which we know exists, I don't want to pass a value judgment on whether it is good or bad. As you know, you cite the Pew study, and the different communities are quite happy living separately. And this is across the world. You don't have, you have in India or anywhere else you go, you have gated communities, etc. So there is segregation galore in the world. And across cities, across towns, across villages, across religions, etc. And I think your approach of finding out, does it matter, is important. Not that segregation exists, but does it make a difference? And I don't think your results present any indication that it makes a difference. They live differently, etc., etc. And if you combine this with wages, then it really is, I don't know what one can get, because most of the explanation for wages, and maybe I'm revealing my age, I'm an old-time human capital person, that, we want to know what is the difference. And that's how, as you know, that's how it is analyzed in the US and everywhere else, that what is the difference in wages after you control for human capital. That's what one would like to see. I'll see if there's any other, again, Muslims, you say, have 46%, as you go from 0 to 1, 46% fewer secondary schools. And presumably larger difference than the SCs. And yet they seem to, from 1983 onwards, seem to be able to get a higher wage. I don't know what that means, but I think it does suggest that segregation does not explain any of the difference. Now, there is differential access. It would be interesting, one suggestion is to use in your wage regression, maybe you do already, the dissimilarity index. So just look at the Muslim equations and put in the dissimilarity index across your blocks or regions, etc. Does it make any difference? Same thing for SCs. Does it make any difference how dissimilar you are? And I would really encourage that after controlling for human capital, that would be, I think, a very interesting finding, that amongst Muslims or amongst SCs or amongst the others, that after you control for dissimilarity and after you control for education, so does it, after controlling for education, does dissimilarity have any statistical effect? I'll end there. Thank you very much. But really quite a robust analysis as well as collection of data. Thanks.
Thank you, Dr. Bhalla. Before Kritarth, you answer, I also wanted to add to, I have a couple of questions, but I'll come after after Professor Kundu comes. But I wanted to join in the argument which Dr. Bhalla made. I come also from a minority community, as you can see, and I've also find that people from my community tend to get segregated and live in clusters, right? And I'm more marginalized than the Muslims. But does that, in a way, make me weaker? That I'm not very sure. So I agree with Dr. Bhalla that worldwide, this segregation is practiced and generally voluntarily. It's not for any other reason. The other thing which Dr. Bhalla was making, and I totally agree with it, was that I move and travel across the country extensively. if there is lack of public access to education, but did it really impact employment or self-employment? And that is where I think his argument on wages is showing up. Because on technical skills, on market domination, there is, and this comment of mine, both the previous and now, is more towards the Muslim population. Market after market, dominated by the Muslim community, working extensively. Technical skills, again dominated by the Muslim community. So, yes, maybe there's a shortage of schools, but did it translate in shortage of self employment or other employment? Means what is the impact of it? The third, after reading your paper, I was consulting a few health experts who have been active in public policy and asking them that is there a sort of disadvantage to the Muslim population because of lack of public health or public hospitals in the areas. And what I understand is that that is not true. So I would totally agree with some of the comments made by Dr. Bhalla. And I would recommend, can we have your response to Dr. Bhalla? And then I will invite Professor Kundu to share his thoughts. Is that okay, Kritarth?
Sounds good.
Please.
Yes, I think on the question of data quality, yes, I think we are limited in that we only have a cross section, so we can only talk about instances that happened during that survey in that year. And yes, like from the economic census and ICCC, we don't have any information on wages. So as to the effect of what segregation or minority shares have on wages, no, we're not able to answer that question. In fact, I think one really big part of this is that it's so much more important now to be able to answer those questions, to have wage data at the neighborhood level to be able to answer these questions. Because if you're aggregating to a district, there might be other things happening at the neighborhood level that we might miss. So yes, if we had wage data at the neighborhood level, it would be really interesting to answer those questions and see how they compared with the NSS. Unfortunately, we in this study we do not have access to wage information of the respondents. And again, like this is this is a cross section, and even if we did have it, this is not a causal analysis. So to the questions of does segregation affect wages positively or negatively, we can't answer that. And we also cannot answer, say, for example, if lesser provision of health services led to worse or better outcomes, because we also don't have information on health outcomes at this granularity. And I think the biggest challenge for us and for anyone studying this is also that how do you manage to get data at such a high resolution where things might look different than the aggregate level. And right now, from this study and from these data sets, we do not have information on health outcomes as well as wages. So we won't be able to answer any questions on that. We do have information on incomes and assets, and we do control for them. And our results are broadly robust to controlling for them. Even though the magnitudes do decrease, they're still negative. So on subcast analysis that Dr. Bhalla had raised, yeah, it would be nice to also kind of do a subcast analysis within them. It's much harder to classify names into jatis than it is by religion. But we do have other work in progress that is trying to look at social norms by jati, and at some point probably we can also look at segregation through that lens. But as of now, we do not have a subcaste analysis just because of the enormity of classifying names into all subcastes in India. The other question, I guess, on again, another question on employment is, it would have been really great to be able to answer questions on employment as well. I know there are a lot of questions that were raised on wages for casual workers and otherwise, also on self-employment, but the impact of what this education had on employment or wages at this granular level, it's unclear. Um, uh, to the extent that we have public facilities provided at the neighborhood level, it is possible that even if you didn't have a school or a hospital in your neighborhood, you were able to walk across to another neighborhood. In fact, there's often stories of people traveling large distances to be able to attend schools, and that being glorified. But whether or not it is, even if whether or not it is desirable for people to have frictions in accessing education or health outcomes, it's probably not desirable. So I think that's all we can say. And yes, like whether or not these education and health disparities actually lead to worse wages or health outcomes is not something we'll be able to answer with this data set at this point. But yes, all this means is that if we had more granular access to data at the neighborhood level, we would be able to answer these sets of questions on wages as well as health outcomes. I think just in terms of what we can answer is that yes, there are fewer schools and fewer hospitals. And then it's a question of, I guess it's, goes into policy on that. But that is all we can say for now.
Dr. Bhalla, you have a supplement question?
I just wanted to clarify that at least my points and my needs are not for, I don't think more granular access will answer any of the questions that I've asked. So that won't solve it. But what will be very useful is if you can do, and it's not the subcasts and how information on subcasts affects. I just want to know you've got a dissimilarity index across regions or across localities, etc. So there are Muslims who live in highly dissimilar areas and highly similar areas, similarly with SCs. So do their education outcomes, etc., is the dissimilarity index significant? That's all. But you can answer that later.
So,
Sure, maybe
Kritarth?
we could look at whether these results are robust to adding the dissimilarity index as well. That's an interesting point. It's been our experience that these are surprisingly robust to adding a bunch of controls, but yes, we could show that in an appendix for sure.
Professor Kundu?
Just a second. Thank you, Professor Charan Singh, for giving me this opportunity of sharing my thoughts on this. And I must congratulate you personally and EGROW Foundation for organizing this presentation on a very, very important topic. Find out the inequality in the access to basic amenities, the process, the segmentation, and of course, the educational mobility, which is built into the third section of the analysis. And that's why I accepted this task of commenting by burning a few hours of my midnight electricity, because I got this 24 hours notice, less than that. But I think it's a very, very impressive work that has been done. I mean, I'm aware of analysis of discrimination or access to basic amenities done by other scholars in India, but based on very fragmented evidence. I'm aware of Kritarth Jha's work, also the work done in King's College and many other India centers in the United States. They are again based on very limited sample and some amount of theorizing and bringing in the global experience. But somebody looking at the data at the neighborhood level and is doing this detailed analysis on the basis of data which were lying for 7, 8 years. I mean, I was just wondering how come I didn't think of doing that. I knew Asher coming to India often, and I must congratulate, you know, I must congratulate both of the whole team for this very important work. But there are questions. I would agree with many of the questions that Professor Bhalla has raised, and I would like to share some of these. But certainly, the issue of inequality in the labor market, access to employment, and the earnings is an important topic which needs to be analyzed in great depth by taking the occupations, the endowment factors of different communities, and find out whether there is any discrimination or not across different states. Similarly, access to basic amenities, Sachar Commission and post-Sachar Commission, with which I was associated, we have done some analysis, but certainly not at this level that has been done in this study, although at the time of post-Sachar analysis, this data was available. Let me share 2 or 3 points because I have not been able to really read every section very carefully to be really write a commentary. But first thing is about data quality. And there I agree with Professor Bhalla. Surjit has written on the quality of socioeconomic caste census data and the fact that the deprivation level works out to be much higher in this year of 2013, particularly based on the 6th economic census. I think there are problems because I think, as Surjit has written, I have written that at the time of socioeconomic caste census, everybody knew that the data will be used for certain policy purposes, for identification, and understandably, there was overstatement as far as the deprivation is concerned. Whether that varied across different communities is an issue that depends on the psychological uncertainty that I would not be able to comment on. But I would talk about the economic census data. 6 economic census data, at least 4 or 5 states have simply said, sorry, we are not accepting this data. Delhi case, can you imagine the number of establishments in many situations have gone down. So I'm happy that the 7th one is on the way, 7th economic census, and we should be in a position to update this, the data and also the findings, and we would in a position to analyze perhaps a little more rigorously. But I'm happy about one thing, that this result pertained to the period 2012-13, and things have changed after that. We have to see, as Professor Bhalla was mentioning, as he has written about the labor market wage differential, and he has shown clearly that as far if you take at the aggregative level, rural, urban combined, and all the occupational categories together, certainly, I mean, this is a finding, but one needs to go deeper, and one can discuss this result as a part of the methodological, path breaking. We have to see whether this methodology now. We can discuss the results without bringing in our emotional attachment for or against the present political disposition. We can say, look, this is the data system that we have to analyze, and let's not bring in the present likes and dislikes about the government. And we can discuss this very, very positively. And that is, I think, very important. Now, let me briefly make statements about the 3 issues that you have raised. One is that of segmentation. I think if you combine Jammu and Kashmir and Kerala, and to some extent large number of districts in West Bengal, you get this result of bimodal distribution. The things are very, very different in terms of not only access to amenities. I mean, if we are talking about this high level of discrimination, that you say, well, that's what is happening in the central areas, one would get that impression. But this bimodality is coming because you're combining Jammu and Kashmir and Kerala and partly West Bengal into that. So that I have a feeling that if you want to study the locational pattern of basic amenities, then you would have to really perhaps take these 2, 3 states separately. I just wanted to mention one more thing, Radhika, that the information in economic census on the public establishments have been on the lacking side. In many cases, the government offices and certainly the defense related and other ministry related services have not been included. I was just wondering whether that would affect the coverage of the government schools also in the economic census. I'm not very sure about that, but I'm quite sure that I worked on the 6th economic census data. The coverage of the public establishments have been on the lower side. That is one point that I wanted to mention. As far as the segregation, residential segregation is concerned, the point that Professor Bhalla and Professor Charan Singh have mentioned, that this is not forced. This is voluntary. I want to know in which country there is force applied, saying that you get out from this place and go somewhere else. It's always voluntary. Voluntary decisions taken by the individuals and the communities on the basis of the present situation. In Ahmedabad, there is significant movement of people across the communities. There is a study of the southern states. There are people who have moved from one village to another village just to go to a village where Muslim domination is there, hard percentage is there, and many of the villages Muslim. Some move to those villages. So you shouldn't say, oh, it is voluntary. Basically, what the study shows that yes, there is some kind of a segmentation. There is a process of bimodal distribution, polarization. So I was in Kerala in a district, Mallapuram. I was asking whether there is any discrimination in access to amenities or labor market. The youth there, all Muslim youths, could not even understand my question. He said, what kind of discrimination? Why do you think discrimination should be there? Because this is Kerala and 83% of the population in that district are Muslims. So I would think that, if you want to study that, you have to, some state level analysis has been done. I have to look at this with greater depth. But that is one factor that strikes me. As far as the access to basic amenities are concerned, at the national level, also, it is very clear that access to the primary health facilities, access to even the child care thing, they are much less as far as the Muslims are concerned at the aggregative level. This has been brought out by such a committee, by post such a committee. Access to public health facilities are lower, but you are talking about outcome indicators. Believe me, committee after committee have said that despite lower access to the public facilities, health outcome indicators for the Muslims are better than scheduled caste, scheduled tribe, and Hindu OBCs also. There is a greater expenditure, private expenditure. So you're talking about voluntary decision, private expenditure on health facilities by the Muslim community is much higher. And that's why infant mortality rate, particularly for the girl child among the Muslims, is less than among the Hindus. So I think this has to be brought in. The health outcome indicators might show certainly better results for the Muslim community because of other socio-cultural factors. As far as education is concerned, it is indeed true that there are again household level factors, social factors, cultural factors, historical factors, which is resulting in a much higher dropout rate along with the affordability issue. Among the Muslim community, dropping out from the schooling system is because of economic affordability. That accounts for 28%, whereas for the other communities, it is somewhere like 18, 19%. So certainly the economic affordability issues are there. And I think this is the point that Surjit was also mentioning, that as far as education is concerned, those who can afford, even people in the middle class, are not sending their children to the neighborhood schools. They're sending to the schools that they think would be building a future. And if you look at the consumption expenditure data, particularly for education, the 75th round, you do find that the out-of-pocket expenditure in the poor households, particularly Muslim households, is 1/7 of the average. So basically, the personal expenditure in education is less, expenditure on health is higher, and that could explain to some extent the neighborhood school being left out to the poorer sections of the population. As far as the final point about the youth not having, there is a disadvantage in the Muslim neighborhoods. That's a point which is very well taken. I think most of the studies by NCERT and also NIPA shows that the intergenerational mobility is pretty low in the Indian context. And even within the community, you find the same thing is there. And education has not really been taken as seriously, educational deprivation in the Muslim community and also scheduled caste, scheduled tribe community, because a large percentage of them respond by saying, this education is not relevant. We don't find it interesting. It's not very useful. As I said, 28% of the Muslim drop out because of affordability. But a large section of scheduled caste and scheduled tribe population also drop out because they don't find the present education interesting and useful for their career. I just want to finally mention one thing, a paper which has come out last year in Area Development and Policy from UK, which shows that the migration of Muslims from rural to urban areas in the last 3 decades have gone down. Although percentage of Muslims living in urban areas is about 40% compared to something like 27% for the Hindus, but or 28% for the Hindus. But nonetheless, present migration rate from the rural to urban areas for the Muslim and also for the, to some extent, scheduled caste, scheduled tribe population has declined. That could be because of the labor market demanding more skills and these communities not having that. But that is also reflecting some kind of a segmentation and difficulties in access to basic amenities. And that's where I was thinking perhaps the rural-urban pattern would be somewhat different because urban areas are becoming much more difficult for the marginalized community, particularly Muslims, to have access to housing market or in the labor market also. And yes, sorry, just the final point about Surjit bringing in the labor market discrimination significantly in this. I would say, since this was not focused, the presentation was not on the earnings and access to employment, one should look at the labor market discrimination only largely for the regular and salaried class, not in the casual category, because Muslims work there in all kinds of, not outside, they work outside agriculture. They are in carpentry, traditional leather industry, and obviously the average earning is higher. But if you focus on the salaried class, you find earning differential, wage differential is only 7%, which can be attributed to discrimination. Because what we do in the discrimination, we separate out the effect of endowment difference, and you find only 7% of the difference in the earning for the Muslims is because of discrimination. But 60% of the difference in the access to employment for the Muslims in the urban regular class is because of discrimination. Access to employment is the major issue in the urban areas, and that needs to be brought out. Maybe Professor Bhalla did mention that he would be looking at this, but I think this is an important area on which research needs to be done, because India is talking about, we are all envisioning a future which is with everyone's confidence, with everyone's togetherness, sabka vikas, sabka sath. These issues should not be put under the carpet. They need to be investigated with empirical rigor. And I think this study certainly is a very serious attempt in that direction. Thank you. Was I audible?
Yes, thank you, Professor Kundu. I'd like to take your questions one at a time. I think it was.
Kritarth, I'm just intervening because Professor Kundu has made substantive comments, and I was thinking I'll take 1 or 2 more questions, and then we're already at 6:17, and then we'll conclude after that, if you don't mind. Right? Now, I wanted to check with Mr. Khalid Khan if he had any observations to make, or anyone else has any observations to make. Of course, in the chat box, there is a question: do you agree that the NEP, that's the new education policy, will change the situation? That's one question. But anyone else in the audience would like to ask a question, please?
Thank you. Yeah, I have one question. Actually,
Yeah.
I need some clarification on methodology. Am I audible?
Yes, you are.
Yeah, yeah, Kritarth, I saw your paper, and you have used three data sources: IHDS, economic census, and mm, then socioeconomic caste census. And your analysis is at block level. But I could not understand how have you uh, analyzed this data at block level. Did you match the block level uh, data from these three sources, or there is some other alternative way? And another question is related to this economic census data. This data is on the ownership of private enterprises. So, um, uh, and you are coming to the conclusion that the distribution of private enterprise, these basic services uh, may have implication for the discrimination or any kind of adverse consequences with regard to Muslim community. My question is, can we relate this distribution of these services using the data from economic census with the outcome variable, like outcome in terms of education and ownership of educational institution? So again, if we see the quality of facilities in Muslim ghettos, for example, schools, there are lots of unaffiliated schools. They don't have direct affiliation from the government, uh, from boards, but there are lots of informal schools running in Muslim localities, particularly at lower level. So it would be better if you could control these factors, because the quality of the services uh, has not been discussed in your analysis. Similarly, this is true for health services also. There are low quality private health services in Muslim localities. So I think if these factors should be taken into consideration while doing this kind of research. Thank you.
Anyone else who would like to ask a question, please? This is the last round. We'll take questions and then we will ask Kritarth to respond, and after that we'll close. Anyone else, please? Just raise your hand. Kritarth, I don't see any other hand. So I think, oh yeah, here is Devarupa. Devarupa, would you
Hi.
like to ask your question?
Yes, good evening. Actually, I wanted to ask a few questions. First of all, you mentioned that, Kritarth, you mentioned that you have taken neighborhoods across rural and urban areas. So have you considered comparing between the rural and urban areas? Because what you have taken are educational facilities as well as health facilities, which are distributed, like public health facilities and public educational facilities are distributed in different ways in urban and rural areas. So when you are taking it in consideration at the neighborhood level, this might means for a certain group of population, certain number of population, one educational institute or one health institute might be there. So have you considered this form of variable? And secondly, public amenities. So by public amenities, we generally address basic amenities like sanitation or drinking water and housing facilities. So like, why am I telling this? Because no doubt health and education facilities are important, but once if a person has a certain economic access, he or she may avail education facility or public or health facility in certain other part of the city, or they might go for private facilities. So this might be an aspect of the study. This might come out like, if someone has the economic power, they might go to some other part of the city or town and they can get those services. So what are your thoughts on that? And as you were saying about the Muslim population, so we know that basic education facilities, a bigger number of the Muslims, they go to madrasas, right? So if you are considering this aspect also, like these things in your study also. Thank you.
So I think, Kritarth, we'll close with that. And now it's over to you. There is, of course, a question here from Omkar, why we don't have one central databases for all these services with same call number, something like that, right? So we have a couple of questions, and I leave it to you. And there's another question by Tirthyani Panda. In case of health services, there could be factors like believing in modern medicine and health facilities. And I think which means vis-a-vis the traditional medical facility. So I leave it to you now, and I'm happy to get your response starting from Professor Kundu, please.
Starting with some of the questions that Professor Kundu had raised, we did do the analysis by dropping JNK, but not West Bengal. So maybe we could test for that as well. But we have dropped JNK, including or not including it really didn't make a difference to any of our results. And again, on it was interesting to know about the higher dropouts from schools among Muslims. That was not a number I was aware of, but that could be behind why they end up getting lesser education in neighborhoods. So that would definitely go into like what causes this. But as again, like it's a limitation of our paper as well. We don't really look into causes, but that could very well be the case that for whatever reasons there are higher dropout rates, and that could be an interesting direction to study in. And again, it would really be nice to have better outcome indicators for health as well. But from the SECC and EC, we really don't have it. Perhaps when the next round of census is done, maybe we'll probably have some of those in that as well. And I guess, yeah, I guess also on migration, again, we we do have plans on looking at migration within this data, but it's extremely difficult, and that's probably something we'd look at in another paper and not this one. But it would be interesting to see if the SECC and the EC could be used to study migration as well. I think those are all the things I have, though I might have missed a couple of implicit questions in there. Yeah, I think one question that Professor Kundu had on coverage of public services in the EC, I guess, yeah, that could be another point on data quality, is that, whether or not a school is public or not, we rely on what the economic census tells us. And in that sense, it's the only source of getting this very granular information on public schools and health facilities. So it would be nice, probably as the next census comes around, to see what the coverage is. At the village level, however, we do have earlier censuses as well, and we see even at the village level for earlier censuses, we see very similar results. So it is quite possible that the coverage is decent enough. I think those are all of Professor Kundu's questions. I know we have 5 minutes, so I'm really going to go fast with all the questions. On the NEP changing policy, I guess it's too soon to know, but the NEP does have a clause which kind of has a locational component to it. I think every neighborhood should have a school within 1 kilometer. I forget the exact specifics. So it would be interesting to see, as the NEP is implemented, if every neighborhood gets its own school, and what changes that does. but apart from that, I'm also not very aware of what changes the new NEP is proposing. On Mr. Khalid Khan's questions, our data sources, we use the SECC and EC, but we do not use the IHTS. And we match them at the neighborhood level. So when I say block, I meant enumeration block and not not the administrative block, but rather the enumeration block, which is below the town or village level. So it's the lowest level that we have information on, and we can match these on IDs for the SECC and EC. On the quality of services, I'm going to bunch this question with something that Dev Rupa had also asked. Could there be informal schools and private health facilities? We do have some results on private health facilities as well, which have a similar story, but they're not shown here. On informal schools and madrasas, we don't have information on madrasas in the SECC and EC, but from the DICE data, we do know that it's a very small percentage of Muslim students that go to madrasas all India. So it's unlikely that that is driving any of our results. I believe the number is around 5%, but the exact number varies from year to year. And now coming to Dev Rupa's questions. Do we compare across rural and urban? No, we do not. We kind of keep those analyses separate. So yes, it is possible that if there is a village with a school, which someone from a nearby town goes and accesses, we won't catch that, and that is definitely a limitation. Similarly, if someone within a town or a village is traveling a large distance to travel to visit, to attend a school or hospital, again, that's not something we control for and could be an issue, and that's our limitation. Let me see. I think there were two more questions in the chat, which was why is there no central database? Actually, yeah, like there have been attempts to centralize all these data sets and make them talk to each other. There is one by Niti Aayog called the NDAP, which we had also, DDL had also worked with. National Data Analytics Portal. They kind of try to combine data sets across ministries. But because it's not at the enumeration block level, it's often at the district or town or village level at most. But that's an interesting central database to get a lot of data sets on. One question on health access being on belief in modern facilities. Our health variable actually also has traditional medicine such as Ayurveda, Unani, and other non-hospital entries. So this health coefficient takes care of that. Yeah, yeah, on question on the Aadhaar linkage, yeah, we don't have that information, though that's probably a privacy breach as well. So I guess there'll be more legislation on data use at the personal level, at an individual level, but yeah, we do not have any more granular data than this. But I hope I got all questions. I'm not sure if I've missed a couple, but yeah, that should be it from me.
Thank
Professor
you
Singh,
so
can I
much.
take half a minute? Professor
Sure.
Singh, Amitabh.
Sure, Professor.
Kritarth, I must draw your attention to a very, very important study done by one of the members of Prime Minister's Advisory Council, Dr. Shremika Ravi. She has analyzed access to basic amenities on the basis of the latest, NFHS data for the Muslims vis-a-vis the Hindus, and she shows the distinct improvement in the access to drinking water, sanitation, and gas access to LPG cylinders, mobiles. And that is the development since 2000, NFHS 4 to NFHS 5. And she has also done an extensive analysis at the district level, focusing on the bottom 20% of the population. This really, in a way, has rough edges with the situation that you have described, and I think it would be worthwhile looking at the data. I have examined it. There are some issues, but it's a very, very useful, rigorous analysis, taking your discussion to the contemporary situation. Thank you.
Let me thank all of you for this rich discussion on a very important topic. This is a burning issue, very sensitive issue, and we at EGROW wanted to take it by the horn. The data was from 2011 to 13, and we knew that being a sensitive issue, this can have various concerns and implications, but it is also important because it has various policy implications. My own feeling is getting reflected in what Dr. Bhalla and Professor Kundu mentioned, and just now, as my own little anecdotal research in the last few days after reading your paper showed that in the last decade, much would have changed. As Professor Kundu mentioned, it could be access to clean drinking water and other facilities. Also, because of the online facilities available both on education and health, much would have changed. And neighborhood analysis, probably good, rigorous, and thanks to you for putting it in such a disaggregated manner. Thanks to you for that extensive research. But I think neighborhood research, looking at the physical movement, would probably change because of the digital revolution that is taking place in our country now. It would be interesting to see the next set of results which come from this socioeconomic study, as well as your research, which you have mentioned, you're trying to complete and bring it to the audience. Once again, and so much in-depth analysis and evaluation exercises are essential. That is what your research is bringing us to. I'm very fortunate. We at EGROW Foundation are really fortunate that Dr. Bhalla, who was in the Prime Minister's Economic Advisory Council until 3 years ago, and Professor Shamika, whose research Professor Kundu just quoted, is right now in the Prime Minister's Economic Advisory Council. So we have the benefit of scholars and policymakers sitting with us, listening, talking to us and sharing with us, and also analyzing such scholarly research which is being presented here. I want to thank each one of you. Professor Kundu is right. After having read your paper the second time, I invited him only yesterday and told him he has to be here. And he, along with Khalid Khan, both have participated in the discussion today. Thanks to both Professor Kundu and Mr. Khalid Khan. With that, let me thank each one of you for making the discussion so rich. Next week, we are going to be discussing about the Indian financial system. It's an extensive research done by Dr. Ruchir Agarwal, who works at the IMF and right now is visiting Kennedy School, Harvard. He'll be presenting to us his research on the financial sector. I want to mention before I forget that in our country, and I think across the world, there is lack of financial literacy, but I also feel there is lack of economic literacy. So at EGROW Foundation, we are making a modest attempt of spreading economic literacy. And if you have time, do visit our website and look at the small modules which we have started in spreading economic literacy across the world. The aim is simple, that the economists do think and analyze things in a very systematic manner, and that they can contribute significantly in public policy. Also, in a way, trying to share with the world how do economists perceive the world and how they analyze the economy. Means I always wonder while teaching, how did we come out with the circular flow of the economy in estimating GDP? Otherwise, all these years before I studied economics, I used to ask everyone, how do you measure all the satellites and the potatoes and the trucks to come out with the concept of GDP. So I thought we need to share with the world the way economists perceive of the world, how they think about inflation, what do they think about trade, how do they think about the financial system, and of course the basic concepts of fiscal deficits and the GDP. So I would invite all of you to have a look at it so that we can spread economic literacy across the world. With that, let me just wish you a great weekend and hope to see you all next week for Ruchir's talk on Indian financial system. Thank you once again, Kritarth. Excellent research at a disaggregated level. Thanks to Sam Asher also. And I hope our discussion has enriched your thought process and maybe it will reflect in your next version of the paper. Thank you.